So for the next drug which we are looking at, it's pharmacology. That's a gene therapy drug. This is what is known as a Tisagenlecleucel. So Tisagenlecleucel is also known as a Kymriah. That's a brand name, Kymriah. Okay, Tisagenlecleucel. So it's actually a CD19-directed autologous CAR-T cell therapy. It's approved for treatment of B cell malignancies. So the drug class is an autologous cellular immunotherapy. It usually targets CD19 cells, CD19 antigens or so, which are actually surface antigens on the B cells. So what's the mechanism? The human T cells will be collected out, so they will now be mixed with the drug. Okay, so you mix them with the drug. Why? Because you want the T cells to actually become stronger, so that when you reintroduce them back into the body of the patient, they can fight disease more. So this one is more of like is strengthening the immune system, So the an extracellular domain binding CD19, a CD3 that's a CAR, the constituent of the CAR. So a CD3 zeta signaling domain for T cell activation. Okay, so these are all the components that basically lead to what? Strengthening and activating a lot of T cells in the body. Okay, so that's what to now recognize CD19 positive malignant B cells, and that will to now initiate cytotoxicity on those cells. Okay, cytotoxicity is like breaking down the cells of the cancer. So pharmacokinetics, a single intravenous infusion is usually enough. The CAR-T cells expand in vivo, okay, and at least you start seeing them start working in around 1 to 2 weeks, okay, and their work would actually persist for a lot of months to a lot of years. So that's what we got. So therapeutic use mainly for treating B cells lymphomas, okay, diffuse large B cells lymphoma, acute lymphoblastic leukemia, okay, refractory follicular lymphoma, and the rest of them. Adverse effects can actually cause cytokine release syndrome, and it could also be toxic to your nerves, causing confusion, causing seizures, then also the encephalopathy. So that's what we got.